The CDC just voted to enact its biggest revision to the child vaccine schedule in years. In an 8-3 vote, an immunization advisory committee chose to scrap guidance that newborn babies get vaccinated against hepatitis B. The panel says that the risk of babies getting the disease is too low to warrant the recommendation.
If you're a baby that was born to a mother that was tested negative to Hep B, you need to realize as a parent that your risk of infection throughout your early stage of life and probably throughout most of your childhood is extremely low.
To be clear, the CDC still recommends the Hep B shot for babies born to mothers who test positive for the virus. Hepatitis B is a serious infection that can cause chronic liver problems, even liver cancer, which is highly deadly. There is no cure. So what brought on this change at the CDC? Well, HHS Secretary Robert F. Kennedy Jr. has made no secret of his view that America's kids are over-vaccinated. And regarding hepatitis B in particular, he claims that there is no reason to immunize a child against a virus that is typically passed on during sex, although it's also passed on other ways. Other health experts have credited the vaccine with pretty much eliminating hepatitis B transmission from Hep-positive mothers to their babies in early childhood. Joining me now to make sense of all this is former CDC Director Robert Redfield. So this is a pretty seismic shift. Several leading medical groups are fiercely opposed. They say the vaccine is almost risk-free and has been successful. So why are they changing it?
You know, Elizabeth, I think it's important to sort of reestablish people making choices on vaccine based on personal choice, particularly when there's not a risk. I think a lot of the people that are negative to this change were the people that developed these policies over the last decade or two. I think the committee, found the right balance in which they said, if we don't know if the mother's hepatitis B positive or if she is hepatitis B positive, the children should be vaccinated at birth. But if we know, because the mother was screened, that she's not hepatitis B positive, then that choice should be to the mother and the pediatrician and make a decision about the right timing of the vaccine. I think it was a very reasonable decision at this point. I do think people have a tendency to dig their heels in when you're changing something that they recommended.
But is it causing damage or hurting kids to give them this vaccine? I mean, hepatitis B used to afflict tens of thousands of babies before the vaccine. Now it's practically non-existent.
Yeah, the question is risk-benefit ratio. So first you have to ask the question, is there a risk? And I think the committee said that there's not adequate risk. Then the question, adequate benefit. And then the question, is there risk? And I think that's the issue. We don't know all of the safety issues that may happen with a lot of these vaccines. I think the hepatitis B vaccine is very safe. Obviously, I helped develop it when I was in the military. I helped move it to get the soldiers vaccinated. But I do think I've always not necessarily been in favor, as a father of 6 children and now 14 grandchildren. I've never thought it made sense that children had to be mandated to get this vaccine within the first several hours of birth.
As you know, hepatitis B is not just transmitted sexually. It can be spread through tiny amounts of saliva, of blood, on toys, surfaces, cups, spoons, even a toothbrush somebody mistakenly picks up. Given the fact that if you contract hepatitis B as a baby or a small child, it can be so, deadly in some cases if you contract liver cancer, but a lifelong serious liver disease as a result. I
think it's going to be important to look at data going forward to see if there is any significant infection that is now occurring as a consequence of the policy change. Remember, the policy change is not that you can't vaccinate your child, right? The policy change is for the mother and father to decide whether they're going to vaccinate their child, within the first days of life.
Right.
We are still going to say you need to vaccinate your child if you're hepatitis B positive, because we know that's a problem. And we are going to say you have to vaccinate your child if for some reason you weren't screened for hepatitis B, because we want to rule out that possibility. But I think we should get data to see if this policy change has a negative consequence or not. Right now, I personally don't. I actually think this vaccine, along with the human papilloma vaccine, are two vaccines we ought to really push in children between the ages of, say, 10 and 12. There is a duration of how long you have decent protective antibody to hepatitis B once you've been vaccinated. Healthcare workers usually, you know, when they get vaccinated within 10 years, they lose that vaccine protection.
Right.
So I think moving it to 10 to 12 and looking at that time, personally, I think makes a lot of sense. You combine it with human papillomavirus vaccine, and you said in your read-in, one way to get parents really interested in these vaccines is to say to these parents, do you want to vaccinate your children against cancer? Most persons would say yes. If you say, do you want them to get the human papilloma vaccine, they say no. And then you have to educate them.
Yeah, but the HPV virus
it's
can
a
lead to cancer
vaccine.
and does lead to cancer.
It's a cancer vaccine. You started out in your read-in. I think people are making more of the controversy than there really is.
Okay.
And let's see what data comes.
Well, I would like to draw your attention to Republican Senator Bill Cassidy, who just tweeted this: as a liver doctor who has treated patients with hepatitis B for decades, this change to the vaccine schedule is a mistake. Before the birth dose was recommended, 20,000 newborns a year were infected with hepatitis B. Now it is fewer than 20. We have other former CDC officials saying people should ignore this new vaccine committee because they think they're making bad decisions.
Yeah, and I think there are groups that will. I mean, I'm a physician that practices medicine in Maryland, and already I got a letter from the Maryland Health Department saying that they're staying with their original recommendation that all children should be vaccinated within the first 48 hours of life. And, you know, that's unfortunate that we've sort of fragmented and there's been a lot of loss of public credibility, particularly for CDC. But, and Senator Cassidy has, you know, he talks about his anecdote of his one patient that this happened to. But I'm still of the point of view that this is a vaccine, along with human papilloma, that really belongs in children at the age of 10 to 12. And let's see what data comes to see if there's any negative consequences from this policy change.
Dr. Robert Redfield, always great to have you on the show. Really appreciate your analysis of the situation.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.